Causes of diabetes. What causes type 1 diabetes? Type 1 diabetes is caused by lack of insulin due to the destruction of insulin-producing beta cells in the pancreas. In type 1 diabetes, an autoimmune disease, the body's immune system attacks and destroys the beta cells. Normally, the immune system protects the body from infection by identifying and destroying bacteria, viruses, and other potentially harmful foreign substances. But in autoimmune diseases, the immune system attacks the body's own cells. In type 1 diabetes, beta cell destruction may take place over several years. But symptoms of the disease usually develop over a short period of time. Type 1 diabetes typically occur in children and young adults, though it can appear at any stage. In the past, type 1 diabetes was called juvenile diabetes or insulin-dependent diabetes mellitus. Genetic susceptibility. Heredity plays an important part in determining who is likely to develop type 1 diabetes. Genes are passed down from biological parent to children. Scientists are studying how the results of genetic testing can be used to improve type 1 diabetes prevention or treatment. Autoimmune destruction of beta cells. In type 1 diabetes, white blood cells called T cells attack and destroy beta cells. The process begins well before diabetes symptoms appear and continues after diagnosis. Often type 1 diabetes is not diagnosed until most beta cells have already been destroyed. At this point, a person needs daily insulin treatment to survive. Environmental factors. Environmental factors such as foods, viruses, and toxins may play a role in the development of type 1 diabetes. But the exact nature of their role has not been determined. Some theories suggest that environmental factors trigger the autoimmune destruction of beta cells in people with a genetic susceptibility to diabetes. Viruses and infections. A virus cannot cause diabetes on its own, but people are sometimes diagnosed with type 1 diabetes during or after a viral infection, suggesting a link between the two. Viruses possibly associated with type 1 diabetes include Coxsackie virus B, cytomegalovirus, adenovirus, rubella, and mumps. Scientists have described several ways these viruses may damage or destroy beta cells or possibly trigger an autoimmune response in susceptible people. For example, anti-islet antibodies. Infant feeding practices. Some studies have suggested that dietary factors may rise or lower the risk of developing type 1 diabetes. For example, breastfed infants and infants receiving vitamin D supplements may have a reduced risk of developing type 1 diabetes, while early exposure to cow's milk and cereal proteins may increase risk. What causes type 2 diabetes? Type 2 diabetes, the most common form of diabetes, is caused by a combination of factors including insulin resistance, a condition in which the body's muscle, fat, and liver cells do not use insulin effectively. Type 2 diabetes develops when the body can no longer produce enough insulin to compensate for the impaired ability to use insulin. Symptoms of type 2 diabetes may develop gradually and can be subtle. Some people with type 2 diabetes remain undiagnosed for years. Type 2 diabetes develops most often in middle-aged and older people who are also overweight or obese. The disease, once rare in youth, is becoming more common in overweight and obese children and adolescents. Scientists think genetic susceptibility and environmental factors are most likely triggers of type 2 diabetes. Genetic susceptibility. Genes play a significant part in susceptibility to type 2 diabetes. Having certain genes or combinations of genes may increase or decrease a person's risk for developing the disease. Type 2 diabetes occurs more frequently in African Americans, Alaska Natives, American Indians, Latinos, and some Asian Americans, Native Hawaiians, and Pacific Islander Americans than it does in non-Hispanic whites. In modern times, however, when high-calorie foods are plentiful, such a trait can promote obesity and type 2 diabetes. Obesity and physical inactivity. Physical inactivity and obesity are strongly associated with the development of type 2 diabetes. People who are genetically susceptible to type 2 diabetes are more vulnerable when these risk factors are present. An imbalance between calorie intake and physical activity can lead to obesity, which causes insulin resistance and is common in people with type 2 diabetes. Central obesity, in which a person has excess abdominal fat, is a major risk factor not only for insulin resistance and type 2 diabetes, but also for heart and blood vessel disease, also called cardiovascular disease. This excess belly fat produces hormones and other substances that can cause harmful chronic effects in the body, such as damage to blood vessels. Insulin resistance. Insulin resistance is a common condition in people who are overweight or obese, have excess abdominal fat, and are not physically active. Muscle, fat, and liver cells stop responding properly to insulin, forcing the pancreas to compensate by producing extra insulin. As long as beta cells are able to produce enough insulin, blood glucose levels stay in the normal range. But when insulin production falters because of beta cell dysfunction, glucose levels rise, leading to prediabetes or diabetes. Abnormal glucose production by the liver. In some people with diabetes, an abnormal increase in glucose production by the liver also contributes to high blood glucose levels. High glucagon levels cause the liver to produce unneeded glucose, which contributes to high blood glucose levels. The roles of insulin and glucagon in normal blood glucose regulation. A healthy person's body keeps both glucose levels in a normal range, though several complex mechanisms, insulin and the glucagon, two hormones made in the pancreas, help regulate blood glucose levels. Metabolic syndrome. Metabolic syndrome, also called insulin resistance syndrome, refers to a group of conditions common in people with insulin resistance, including higher than normal blood glucose levels, increased waist size due to excess abdominal fat, high blood pressure, abnormal levels of cholesterol and triglycerides in the blood. People with metabolic syndrome have an increased risk of developing type 2 diabetes and cardiovascular disease. Beta cell dysfunction. Scientists think beta cell dysfunction is a key contributor to type 2 diabetes. Beta cell impairment can cause inadequate or abnormal patterns of insulin release. Also, beta cells may be damaged by high blood glucose itself, a condition called glucose toxicity. Risk factors for type 2 diabetes. People who develop type 2 diabetes are more likely to have the following characteristics: age 45 or older, overweight or obese, physically inactive, parent or sibling with diabetes, family background, that is African American, Alaska Native, American Indian, Asian American, Hispanic or Latino, or Pacific Islander American. History of giving birth to a baby weighing more than 9 pounds. History of gestational diabetes. High blood pressure 140/90 or above, or being treated for high blood pressure. High density lipoprotein or good cholesterol below 35 mg per dl. Polycystic ovary syndrome called PCOS. Pre-diabetics, an A1C level of 5.7 to 6.4%. A fasting plasma glucose test result 100 to 125 mg per dl called impaired fasting glucose. Or a 2-hour oral glucose tolerance test result of 140 to 199 called impaired glucose tolerance. History of CVD. Gestational diabetes. What causes gestational diabetes? Scientists believe gestational diabetes is caused by the hormonal changes and metabolic demands of pregnancy together with genetic and environmental factors. Insulin resistance and beta cell dysfunction. Hormones produced by the placenta and other pregnancy-related factors contribute to insulin resistance, which occurs in all women during late pregnancy. Insulin resistance increases the amount of insulin needed to control blood glucose levels. If the pancreas can't produce enough insulin due to beta cell dysfunction, gestational diabetes occurs. As with type 2 diabetes, excess weight is linked to gestational diabetes. Overweight or obese women are at particularly high risk for gestational diabetes because they start pregnancy with a higher need for insulin due to insulin resistance. Excessive weight gain during pregnancy may also increase risk. Family history. Having a family history of diabetes is also a risk factor for gestational diabetes, suggesting that genes play a role in its development. Other types and causes of diabetes. Other types of diabetes have a variety of possible causes. Genetic mutations affecting beta cells, insulin, and insulin action. Some relatively uncommon forms of diabetes, known as monogenic diabetes, are caused by mutations or changes in a single gene. Other rare genetic mutations can cause diabetes by damaging the quality of insulin the body produces or by causing abnormalities in insulin receptors. Other genetic diseases. Diabetes occurs in people with Down syndrome, Klinefelter syndrome, and Turner syndrome at higher rates than the general population. Scientists are investigating whether genes that may predispose people to genetic syndromes also predispose them to diabetes. The genetic disorders cystic fibrosis and hemochromatosis are linked to diabetes. Damage to a removal of the pancreas. Pancreatitis, cancer, and trauma can all harm the pancreatic beta cells or impair insulin production, thus causing diabetes. If the damaged pancreas is removed, diabetes will occur due to loss of the beta cells. Endocrine diseases. Endocrine diseases affect organs that produce hormones. Cushing's syndrome and acromegaly are examples of hormonal disorders that can cause prediabetes and diabetes by inducing insulin resistance. Hyperthyroidism, a disorder that occurs when the thyroid gland produces too much of thyroid hormone, can also cause elevated blood glucose levels. Medications and chemical toxins. Some medications such as nicotinic acid and certain types of diuretics, anti-seizure drugs, psychiatric drugs, and drugs to treat human immunodeficiency viruses can impair beta cells or disrupt insulin action. Pentamidine, a drug prescribed to treat a type of pneumonia, can increase the risk of pancreatitis, beta cell damage, and diabetes. Also, glucocorticoids, steroid hormones that are chemically similar to naturally produced cortisol, may impair insulin action. Glucocorticoids are usually to treat inflammatory illness such as rheumatoid arthritis, asthma, lupus, and ulcerative colitis.